Hello, my name is Dr. Brian Trautman. Welcome to our series on super helpful tips on better health. Tip number 3 is on backpack safety. So it's the fall time and things are starting to change. The weather's changing. Kids are starting to go back and forth to school. We're starting to bundle up and we're carrying items back and forth. And a lot of times what we're carrying is using a backpack. So the question is, what do I know about backpack safety? What do I need to do to wear a backpack safely? So backpacks, generally, they're designed to distribute weight amongst some of the strongest muscles in your whole entire body. If they're used incorrectly, though, however, it could cause things like sprains and strains and knock the bones of the spine out of alignment, which is not the best thing to have. So a couple important things to note when looking for a backpack would be things like shoulder straps. You want to have them nice and thick and big. You know, the bigger and padded are the better ones. The smaller ones can cut off circulation. If there is a belt, try to wear that. Those are all things that help to distribute the weight more evenly. A padded back is a pretty good thing too, in case there's any kind of sharp things inside it that can poke the child or yourself. Lightweight backpack is always a good thing. Some of the more heavier ones can add more weight to it, which would make it more difficult. Things like a rolling backpack, those are good too, but you have to watch out for things like snow if you live in a snowy area or carry up the stairs. Some things to note is that to prevent injury from a backpack, make sure to try to use both straps. Okay, very important. Once again, it helps to distribute the weight more evenly, but most importantly, let's say if you wear it on one shoulder, that can add to a curvature of the spine or put your body in a position that would cause more of a postural distortion. Not the best thing to have. Things like try to have them pretty close to your body, pretty tight. You want to wear the backpack probably about 2 inches above the waist. And the big thing is how much weight you put in it. I have a little daughter who goes back and forth to school. She's about 40 pounds and generally about 10% of the body weight. And I like to go a lot less than that, especially if it's a little kid, since my kid's probably about 4 years old or so. If it's a bigger kid, someone who's about 70 pounds, 80 pounds, they could probably do more about the 10% of the body weight. A good rule of thumb is if your kid wearing the backpack and looks like a turtle carrying a shell on its back or carrying its house back there, it's probably too big for that child or you. Also, if you take the backpack off and you still see a lot of postural distortion or the posture is in a position that doesn't really quite look right, ask your chiropractor, does this look normal? What's going on? Is my kid supposed to be growing this way? They may have a misalignment somewhere within the spine or the pelvis, and these are all things that we would want to check out at our office. Very important, the spine has 2 major purposes. It does keep us upright as our posture, but also surrounds and protects the nervous system, which controls everything in your whole entire body. A lot of times with these misalignments, they can cause pressure on the nerves. The nerves control everything, and that can lead to deficiencies in our health. Not just us, but our kids. Kids, they don't generally present to our office with things like neck pain or lower back pain, which sometimes they do, but a lot of times they'll show up with things like ear infections or having colds or flus or bedwetting, just to name a couple of them. So try to be more proactive at it. Get your kid checked, get your posture checked, and give us a call. Okay, our number is 262-633-6325, or if you're in Racine, it's 633-6325 or 633-NECK. Also, you can check us out on our website, which is racinechiropractic.com. Once again, my name is Dr. Brian Trautman of Mount Pleasant Chiropractic and Rehab. I'm looking forward to help you achieve optimal health and wellness. Take care.